So Levanto is taking a broad set of these health solutions, all delivered through one app, all integrated. So you don't need to fill out a health questionnaire all over again every time you have a different health condition or a different part of your body is failing you. We get to know you and we can personalize that and we can treat you across stages of your life and across different systems within your body to help keep you healthy.
Welcome to the Business of Healthcare podcast from the Center of Healthcare Leadership and Management at the University of Texas at Dallas's Naveen Jindal School of Management. Here at UT Dallas, we bring together business executives and other thought leaders to help navigate the challenges of our rapidly changing, increasingly complex healthcare ecosystem. I'm your host, Professor Daniel Karnuta, Director of the UT Dallas Professional Program in Healthcare Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any future episodes. You can also join us online at businessofhealthcarepodcast.com. Reforming the U.S. healthcare system is one of the vibrant debates in our country today. I think few would argue that the current system is sustainable, but the answer to reforming the systems are elusive and complex from both an implementation standpoint and a political standpoint. Our country spends over $5 trillion, or 18% of its GDP, on healthcare. That's not sustainable for a lot of reasons, not the least of which is that roughly half of that is funded directly by taxes. One foundational reform model that has taken hold over the last few decades is rather simplistic in concept, but not so easy to universally implement. And it's a paradigm shift of focusing healthcare on wellness versus treatment. In other words, focusing on keeping people healthy or addressing health issues in the early stages at home versus waiting for a health issue to reach a point where the patient ends up in the emergency room. And part of that wellness push has come from employers who fund a significant amount of the cost of healthcare insurance for their employees. The strategy is that healthier employees result in lower medical expenses, which lowers the cost of providing healthcare insurance as an employee benefit. In this episode, we're going to explore the current state of employer-focused wellness with Kevin Kumler, who is president and general manager of a new innovative employer-focused wellness company called Levanto, which has recently been launched by Baylor Scott & White Health. Kevin, thank you for being with us and welcome to the Business of Healthcare podcast.
Thanks so much for having me, Daniel. Looking forward to the conversation.
As we start out, can you give us just a background of your current role, how you got involved in this space, and how you got involved with Levanto, and just an introduction to Levanto?
Yeah, happy to. So for me, this is a little bit of a full circle moment. I grew up in the heartland, Columbus, Ohio. My father was an orthopedic surgeon and president of the medical staff at our regional health system there. And I was the little kid that followed him around in the hospitals, in the hallways on the weekends as he was rounding on patients. And I learned through that how focused he was on the quality of the outcomes for his patients. And nights, weekends didn't matter. He was trying to make sure that they had the great outcome they deserved after their surgery. And he delivered that great care in the hospital. And eventually, he, like most of us, he became a patient in that hospital, and he received great care when he was in the hospital. The problem was a lot of the things that he struggled with his health were happening to him outside the four walls of the hospital. It was all the things in between the appointments where things fell down. And unfortunately, he ended up with a whole chronic care bingo of acronyms of different conditions that he struggled with. And most of it was, again, outside the health system. And so I've been in this world of digital health for the last 15 years, a lot of which is about extending the great care that people can receive inside the hospital, outside the hospital. And that's essentially what Levanto is doing. So Baylor Scott & White launched this. They've been building these products for the last 3 years and now are launching in the commercial market of taking the care that Baylor Scott & White's known for, most trusted, largest health system in the state of Texas, and helping extend that care into people's homes and in their pockets through their phones so that they can get the healthcare they need to stay healthy, not just treat them when they're so sick that they end up in one of our facilities. So I was really inspired by the mission and the commitment to that strategy, and that's how I ended up here.
So employee wellness has been around for a while, the concept, and it's been implemented in a lot of employers that I've actually been with that have tried this, and it's been sort of not the easiest to deal with, trying to find the right solution as an employee that's being offered to you. So what differentiates Levanto from other employee wellness offerings that we've seen to date?
It's really two things. One is this concept of an integrated portfolio of solutions. In my last company, which would have been considered one of these point solutions, we focused on diabetes reversal, had amazing outcomes, but it was relevant to a fraction of the employer population. And so many of these employers are going out and cobbling together a portfolio of these things. So a large Fortune 50 company might have 40 or 50 different benefits vendors for their employees to choose from, which sounds like great choice, but it's also overwhelming. They don't know what they need, when they need it, and how to access it. So Levanto is taking a broad set of these health solutions, all delivered through one app, all integrated. So you don't need to fill out a health questionnaire all over again every time you have a different health condition or a different part of your body is failing you. We get to know you and we can personalize that and we can treat you across stages of your life and across different systems within your body to help keep you healthy. The second thing that we do that's truly unique is it's integrated with the downstream healthcare system, which is where most care is delivered today. So we can not only extend that system to you through your cell phone, give you digital tools and assets to work with at home, give you access to virtual care so we can meet you where you are. We can also give you seamless access to the experts at Baylor Scott& White if and when you need that in-person care. And that combination I haven't seen anywhere else in the market.
Now, does an employee that's using Levanto's digital product, does that employee need to be near a Baylor Scott& White facility?
No, absolutely not. So think of it as three kind of levels of care we can give people. We can provide digital tools. So in something like our healthy weight solution, we can give people an AI food tracker. They can take their cell phone out, take a snap of what they're eating, and it will log all of that food for them for that day, which one of the biggest challenges in weight loss historically is people having accurate food logs so they understand what they're putting in their body and the impact it has on their health. We can do that seamlessly in their pocket anywhere they are really in the country or the world. They could pull out their cell phone and take that picture. The second level is virtual care, connecting you with an expert either in real time, synchronous, or asynchronous through chat or text messaging. That we can deliver anywhere where we have clinicians who are licensed to serve that patient, and they're doing it remotely, so it doesn't matter physically where they are. Today, we're providing that anywhere in the state of Texas, and in some cases, we'll be providing it outside the state of Texas as well. The third part, where you are going in person for care, you maybe have been working on your weight loss journey, not seeing the results you want, and it's clinically indicated that you might want to do bariatric surgery. In that case, yes, you will have to get into a facility, and it's typically going to be one of our Baylor Scott& White facilities, and we have those, reasonably accessible for most of the state of Texas. And then over time, if we need to partner with other regional centers around the country to give people that access as we expand nationwide, we'll do that as well.
How does Levanto then coordinate with an employer's existing health insurance plan?
When we onboard with a new employer client, we know what their health plan or plans are because many times an employer may offer multiple different plan options for their
Mhm.
employees. So the employer is covering the access to all the digital tools and products for a low fee for those individuals. And then after that, any care that somebody needs to receive on top of it, if they're doing a virtual mental health consult with a therapist, we bill that back through claims seamlessly through their existing health plan based on the existing benefit structure the employer already has in place. So we're really trying to plug into the systems that are there as opposed to recreating everything. We're investing most of our innovation talent around building the best solutions and integrating them with each other, not trying to recreate the way all healthcare is delivered and paid for today because the employer already has a system that is working for them.
So Levanto integrates with and knows in-network versus not in-network providers,
Exactly.
regardless if Baylor Scott& White is part of that in-network or not.
Exactly.
Yeah.
Exactly.
So how do they look at the value proposition here? Like what is it as simple as, we're just going to try to keep them healthy and out of emergency rooms where it's expensive? Is that pretty much it?
I think it's a big part of it. You started off talking about how expensive and unsustainable the current healthcare environment is, and half of it's paid for through taxes. Employers are probably the largest sponsor of healthcare in the US today. Certainly, if you look at the average health system, they're held up by what the employers are paying for care. And those employers really want two things. One, they want their employees to be healthy and productive, right? They have a business that they're trying to run. That business is run on the talent, and they want that talent to be able to deliver for them. And because they are paying for the cost of this healthcare, they also want to feel like they're getting real value for it. And they're seeing several areas where it could be better. And so many of those employers have gone out and said, beyond our existing health plan, beyond the solutions that are available in the market today, my employee base has a certain need. Either they have a healthcare need that's not being met, they need better access, or they feel like they're not getting value from the existing system. That's where they want to work with somebody who's going to help them provide something better. So in our case, again, across a range of different solutions, I'll give a couple of examples. We provide a product called First Contact Navigation. This is really helping people at the very top of their healthcare experience. I've got an issue or a symptom. Where do I go? And I'll talk through the value to both the individual customer and to the employer. For the customer, it helps give them confidence that they're going to the appropriate place for their condition. And for the employer, it helps make sure they go to that appropriate place, both clinically and financially, for their condition. So the easy button would be to say, you got a sniffle, you got anything, go to the emergency department. The emergency department is a great place to go if you have an emergent condition. But if you don't, it is both wildly expensive to the employer and the employee, and maybe dangerous for you to be in if you are not that clinically severe. In our First Contact Navigation solution, we've actually found that 80% of the people who had planned to go to the ER for their condition, once they went through the nurse triage approach, they went to a place that was more clinically and financially appropriate. So they were able to avoid going to the ER when it was unnecessary. Those last 20% who should have been in the ER, they still ended up there. But for the vast majority of people, you're helping them get to the more appropriate place for them.
Yeah, and there's no question about that. And I can tell you from my experience as a past recovering CFO, one of our biggest budget discussions every year was around health insurance expense for our employees because it was a huge cost. And you're right, it's two things. It's trying to lower that cost, but it's also about trying to give a product that your employees are going to be happy with. Because if your employees aren't happy with the product, that decreases your attractiveness as an employer, to attract new employees. Part 2B of that would be productivity. You're also spot on about that. Just from a real world perspective, that if employees are sick or not there or have high absenteeism, then they're not productive. And the business of healthcare, the business of anything, is about productivity and productivity from an employee standpoint. So a product like this is extremely valuable, I think, to employers. And with that in mind, as you launch, how does the pricing model work for the employer?
Yep. So we started to go out to market last year. We've been building the products for 3 years. We went through a prototyping phase where we got people engaged in the products to demonstrate the clinical outcomes, because that was step one, be able to go out to employers in the market and say, these products work. They know and trust the care at Baylor Scott and White, but many of these products involve new features, new components, new access. So we wanted to demonstrate that these were safe, clinically valid, and delivering the outcomes they're looking for. Once we did that, we went out to the market and started talking to employers, and really we wanted to fit in and make the decision easy for them. So one piece, again, is an access fee, a very low per eligible employee per month access fee to get access to the app, the tools, and the care. And then anything else that is consumed beyond that, where people need additional care, that's paid for through claims, so that we didn't have to set up a net new payment mechanism. We didn't have to go to your former colleagues on the finance team and they had to figure out an entirely different way to budget for this new thing. It's just people consuming the right care for them based on their existing health plan and access to a new set of tools that should help keep them out of the unnecessary care that drives a lot of the costs.
So Levanto's revenue model out of that is largely per member per month, PMPM,
Yep.
as we call in the healthcare space. And a lot of vendor charges and insurance charges are based on that type of a model, per member per month type of thing.
Employers are used to buying that way. So we didn't want to recreate all the parts of the wheel. We didn't want to recreate the business model. And in many cases, they may be paying for multiple point solutions today that they could eliminate and pay less to have a broader suite from us. So that's part of the value proposition as well.
Yeah. Yeah. It's simple from an employer standpoint, from a budgeting standpoint, and a tracking standpoint, tracking the cost as you go along through the year. So that's a good model.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
I'm imagining, and we can't get away from this discussion or let you go without talking about artificial intelligence. I'm assuming that there is, based on what you described, a pretty solid base of AI being used.
Yeah. Are you using AI or not at this stage? It's like saying, are you using the internet or mobile?
Yeah.
Absolutely. The key question is, how are we using AI? And for us today, we're using it in 2 main ways. The first is for our back end. It's invisible to the end user, but it is making our operations and our clinicians more productive. For example, we have all of this rich data on what the consumer and the customer is dealing with their health, their prior interactions. This can summarize that the same way if you do a quick Google search now, you'll get the Google summary note. We can have clinical summary notes for those providers to make sure they see the most important and relevant information about that patient up top, even as the encounters continue to stack up on top of each other. So it's not them sifting through an entire history trying to see for this patient what might be most relevant. So those are invisible to patients, but impact their care. And then the other part is patient-facing tools, customer-facing tools. And a lot of this is around personalization. So helping tailor the solution to that individual and to their specific needs. So we can take one example. I gave you the earlier example of the food tracker that is using AI image recognition to understand the food and then can surface for that person in the future common foods that they tend to eat, so they don't have to take a picture every time. They can recreate prior meals and it will surface the ones that they eat most often. With musculoskeletal, for example, muscle and joint care, we have a virtual physical therapy option where we can use image tracking and capturing from the camera on their phone or their laptop or their iPad to help see, are they doing the exercises in the right way? Are they getting increased range of motion, which is one of the indications that they're improving and getting healthier and getting the outcomes that they want? We can course correct them when they're doing the exercise incorrectly. And all of that is powered by AI in ways that feel more personalized and helpful to the individual. And then the last thing I'd say on AI, because there's certainly a debate going on in healthcare, like AI is going to take everything over. We would fundamentally disagree with that. We think AI is going to really improve a lot, but for us, both Baylor Scott and White and for Levanto, this is all AI plus human. And then the real question is, which tasks are most appropriately assigned to each of those groups? And we really want to make sure we're applying our human talent in the places that can make a real measurable and felt difference to the customer. And we think that's going to be a differentiator in the market as opposed to a pure tech-only tool for people.
The human element of your delivery structurally, is it like a call center where you've got trained professionals that are just waiting for the calls to come in from the users and then they can direct them from there?
We actually have a much broader care team, and it depends on which condition you're looking for support and help on, which product. If it's, say, again, the healthy weight product, we have coaches that are there, and in your parlance, it might be call center-like, but it is coaches who are able to exchange messages back and forth with the individual customers who are looking for troubleshooting or help figuring out which foods they can eat or looking for the right educational materials on a specific nutrition program. That's all done by people who are getting the messages in the back end. Again, you could think of it like a call center, but it's not some massive plant where you have 500 people sitting with headsets on. It's, people typically working remotely or sometimes psychiatrists, perhaps with somebody helping them with their prescriptions for their mental health. You can have consulting surgeons. All of those people also can interact through the various products and tools with the customer.
Are there levels of service that an employer could purchase, or is it one product? You get everything.
Today, it's one product. We believe that the entire portfolio being in place and interacting across products is the best solution. So we're taking it to market in that way. And the whole suite is a premium level of services above what the individual employees might be able to access otherwise. So their employers are really giving them proactive tools they can use to manage their health, better access to virtual care that can reach them where they are today, and seamless access into high demand specialists and physicians when they need it.
You've explained a little bit about this with the weight loss product and a few others that you talked about, but as an employee, if I've got Levanto, what does it look like? What do I do? Like, do I have an app on my phone or on my computer? What's an employee see that's got this product?
So we built this on top of the My Baylor Scott and White health experience. So you would either download the MyBSW app on your phone, or you can access it on the web through your laptop as well. And within that experience, if you're a Levanto member, it unlocks a premium set of features and these products, and will present them to people based on their clinical appropriateness, their interests, their history, to help make sure that people end up in the right program. And those aren't visible to everyone off the bat, but if your employer is sponsoring Levanto for you, it kind of unlocks this additional set of features and access in the app, like a premium version.
So if an employer wants to learn more about Levanto, the product itself, is there some place that they can go that, I'm sure on the website or?
Yep. We have a website, levanto.health, where they can also reach out to us directly and have a conversation with our team, and would love to understand what they're trying to solve for and if we can be a part of that solution.
Well, it's a fascinating area to me. I think it's one of the solutions of the greater healthcare reform that the country needs, starting with the patients themselves and hitting them before they actually become patients. I think that's one of the keys to getting us out of this spending cycle that we're in. So we wish you the best of luck with this, and I'm gonna put something on my calendar to try to get you back in a year or so to find out just how things are going.
Yeah, I'd love to. And, based on the conversation, the way you think about these problems and dig into them, it unfortunately sounds like your CFO condition is terminal and incurable. So
It probably is.
sorry about that, but it's made for a really interesting conversation.
Well, Kevin, thanks for being with us. And again, the best of luck to you.
All right. Thanks so much.
Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management and the Healthcare Management Business Degrees and Certificates available to seasoned clinicians, master's students, and undergraduates through the University of Texas at Dallas, go to jindal.utdallas.edu/healthcare.